Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story. And today's topic, memory loss linked to blood flow changes in the brain, is inspired by a case we recently encountered, one that is more common than many people realize. That's why our team is breaking it down from four key perspectives: what the doctor sees, what the nurse manages, what the pharmacist safeguards, and how the dietitian supports recovery. Each piece stands on its own, but together they reveal the bigger picture. Be sure to explore the rest of the series. Now, let's look at this from the pharmacist's perspective. In practice, vascular related memory changes rarely start as something urgent. They appear quietly: a name forgotten, an item misplaced, a question repeated. It comes and goes, so it is dismissed. But from a medication perspective, the issue is not the symptom. It is the underlying vascular process, because this type of memory loss is driven by blood flow, and blood flow is something we manage over time, not in moments. Vascular dementia does not happen at once, it builds. Small vessel damage, reduced circulation, sometimes silent strokes. Each event may be unnoticed, but the effect accumulates. So the pattern becomes early symptoms are overlooked, protection is delayed, vascular damage continues, memory decline becomes more established. Now, this is where medication becomes critical, not to reverse the damage, but to slow progression and protect what remains. Common treatments include low dose aspirin to reduce clot risk, cholesterol lowering drugs like atorvastatin to stabilize blood vessels, and blood pressure medications to maintain consistent cerebral blood flow. Each one has a role, but none of them work instantly. And that is where many patients get it wrong. Because in real life, this is what we see: no immediate feeling from the medication, no quick improvement in memory, no obvious feedback. So the pattern shifts, doses are missed, refills are delayed. Medication is taken inconsistently, not intentionally, but because the benefit is not felt immediately. And that is where the system begins to fail. Blood pressure becomes unstable, vascular stress increases, the brain becomes exposed to further injury, not because treatment is ineffective, but because it is not sustained. So the first principle is clarity. Know what each medication is doing. Aspirin reduces clot formation. Statins protect and stabilize blood vessels. Blood pressure medications maintain steady flow to the brain. They are not for symptom relief, they are for risk control. Then comes structure. Take medications daily. Do not skip doses. Do not stop because you feel okay. Review regularly with your healthcare provider, because consistency is what protects the brain. Now step back and look at the system. Blood vessels support the brain. The brain supports memory. Medication supports the vessels. Break one link and the entire system becomes vulnerable. When managed properly, the outcome changes: slower cognitive decline, reduced risk of stroke, better daily function, safer long-term outcomes. Final point: vascular memory loss is not just about what has happened, it is about what can still be prevented. And medication is not about quick results, it is about long-term protection. So do not wait for symptoms to worsen. Use medication with intention, stay consistent, and review when needed. If you or a loved one has memory changes, do not ignore it. If you are on blood pressure or cholesterol medication, or struggle with consistent medication use, do not ignore it. Speak to your pharmacist or healthcare provider for proper review, or call/WhatsApp plus 200 3320 8720347. And remember to explore the other three perspectives, because each one completes the picture. Stay healthy, my friends.